Hi, everyone. Thank you so much for joining us today. I'm Marche, the webinar director here at Advice Chaser. Before we introduce our guest and get started, I do need to do a little bit of legal housekeeping. Advice Chaser, the host of this webinar, is not a registered investment advisor. We cannot and do not give financial advice. Today's presentation is for educational purposes only and cannot be considered advice for any person's individual situation. Advice Chaser regularly hosts informative webinars such as this one, featuring a variety of knowledgeable professionals, many of whom are licensed advisors. Any opinions, ideas, jokes, or principles expressed by presenters are their own and, however true, funny, or interesting, are not endorsed by Advice Chaser. Please do not act on the information you hear today without consulting a qualified financial professional. Well, we are thrilled to bring you today's educational presentation. A couple of reminders. Attendees are muted, but we do encourage you to ask questions using the chat box, and the presenters will answer those queries during or after the webinar today as appropriate. If you ask a question in the chat box, go ahead and leave your phone number and email as well. And if we can't get to your question during today's event, we'll make sure someone reaches out to you afterwards. We want this experience to be as educational as possible. So again, please don't hesitate to ask for clarification or expansion of the material. Well, I'd love to introduce you to today's guest. Our presenter today is Andy Hardwick, a Metropolitan Public Affairs Specialist for the Social Security Administration. Andy graduated from Brigham Young University with a degree in modern languages and subsequently earned a master's degree in modern psychology. He started working for the Social Security in the New York City area in the disability program, and since coming to Houston, Mr. Hardwick has been involved in public outreach for the Social Security Administration. Well, we're so thrilled to have you here today, and I'm going to go ahead and turn over the time to you, Andy.
Thank you very much. My name is Andy Hardwick, and I'm a public affairs specialist for Social Security here in Southeast Texas. Thank you, everybody, for coming today. I know Medicare can be a complicated subject. I hope that after this presentation, you will feel that you're more enlightened and it's not such a complicated subject. You can always go for more information to medicare.gov or socialsecurity.gov. Okay, and we'll be talking about where you go to sign up for the different parts of Medicare. So if you want to go to the next slide. All right, so let's talk about who can get Medicare. First of all, normally you have to be 65 years old or older to get Medicare. So I know sometimes people retire at 62, 63, and they tell me, well, can I sign up for Medicare at this point? No, you cannot. 65 is the age of getting Medicare or later. However, if you are receiving Social Security disability, no matter what your age, after 24 months, if you don't turn 65 before then, you will be enrolled in Medicare A and B. All right. So anybody who's on a Social Security disability program gets enrolled in Medicare after 2 years, automatically, A and B. Now, there is a 2-year waiting period. However, if you have ALS, Lou Gehrig's disease, amyotrophic lateral sclerosis, or permanent kidney failure, okay? So if you have ESRD, end-stage renal disease, or ALS, you don't have to wait 2 years to come on Medicare. But those are the only exceptions, okay? Everybody else, no matter what you have, if you're on disability, you have to wait 2 years. Now, if you're on disability and let's say you turn 65 after 1 year, of course, you're going to come on at 65, okay? But most people that are on disability are much younger than that. So even after 2 years, they're not going to turn 65. So even a 30-year-old who is on disability after 2 years after 2 years have passed by, will be enrolled in Medicare A and B. Okay, next slide. We also provide Medicare for disabled adult children. Okay, now, if a parent is receiving Social Security, disability, or retirement, or has passed away, until the child is 18 years old, that child automatically gets benefits under their parent. So if the parent was eligible, had enough work credits, or is eligible either for disability or retirement benefits, that child, by virtue of being a minor, gets benefits under the parent until age 18. There is no disability that needs to be proved, okay? But past age 18, if they want to continue benefits, then they would have to prove that they are a disabled adult child, okay? So if the claim is approved and the child is now reclassified as a disabled adult child, then at age 20, after 24 months, at age 20, that adult child, disabled adult child, would come under Medicare. Okay. Also, spouses or widows or widowers of workers who have died. So let's say that the person, that the spouse was either a housewife or house husband, and they never had enough work credits to come on Social Security or get Medicare for free. So at least Part A. So what they can do is, if they've been married, they can use the credits from, or well, actually they can apply under their spouse, and we can entitle them to benefits under their spouse. All right. Also, dependent parents of a fully insured deceased worker. This is in the rare case where a worker dies and the parents can prove that over 50% of their support came from their deceased child. Then they would be able to receive Medicare under their deceased child, even if they themselves didn't have enough work credits, if they were at least 65 years old. Okay, next slide. So how does a person enroll in Medicare? Okay, now sometimes people get this idea that, well, once I turn 65, Social Security is automatically going to sign me up for Medicare A and B. I don't have to do anything. That is not true. Okay, the only people that get automatically enrolled in Medicare are those that are on disability and have received disability benefits for 24 months, or if you were getting Social Security benefits before you were age 65. Like, let's say I took early retirement at 62. Then about 3 months before my 65th birthday, Social Security would mail me my Medicare card, and I'd be signed up for Medicare A and B. All right. Now, if you're about to turn 65 and you're not getting Social Security benefits, you need to sign up for or enroll in Medicare yourself. Now, you don't go to Medicare for that. For A and B, you go to Social Security. So you go to socialsecurity.gov or ssa.gov, and there on the home page, there's going to be an icon that says Medicare. Just click on that, and that's how you sign up for Medicare A and B. Okay. And I know you're probably thinking to yourself, well, A and B, what does that even mean? We'll go over that in a second here. That's A and B now. A covers the hospital, B covers the doctor. But if you want prescription drug coverage, that's Part D. Those are administered through private plans. So you could either go to medicare.gov or call their 1-800 Medicare number, okay, which is 633-4227. Now that's a 24/7 number. So if you have any questions about Medicare, or you want to sign up or whatever, you can call them. But I would say, since it's 24/7, call after 5 p.m. Okay, or on the weekend, because you're not going to have a lot of competition. But if you try to call between 9 and 5, forget it. You'll be on the telephone a very long period of time. But the later it gets in the day, the easier it's going to be. Okay, so Medicare automatic enrollment is for people that are getting Social Security prior to 65. Okay, and as I said, the card will come 3 months before your 65th birthday. Okay, or if you're on disability. But anybody else, you don't get automatically enrolled in Medicare. Okay, Medicare cards no longer have the Social Security number on them, because people were complaining about, I take this card to the doctors and I might lose it, and somebody's going to have a Social Security number. So it has a different kind of number on it. But as I said, for A and B, you're going to come to Social Security for that. It's okay. So here are the enrollment times for Medicare. At 65, a special enrollment period if I have coverage through my employer or my spouse's employer. The general enrollment period is for those people that miss the initial or special enrollment period. So let's talk about the initial enrollment period. All right. So the initial enrollment period lasts for 7 months. All right. 7 months. It really starts 3 months before you turn 65, and it ends 3 months after you turn 65. Okay. So 1, 2, 3 months before you turn 65, the month you turn 65, and 3 months after, which is 3, 3, and 1 is 7. All right. So you have 7 months. You only need to sign up during the initial enrollment period if you are not working at 65 and you are not covered under working spouse. If you're not working, but your spouse is, and he or she has you on their employer health plan, then you don't have to sign up during the initial enrollment period. Okay. If you sign up during the initial enrollment period, 3 months before, 1, 2, or 3 months before your 65th birthday, your coverage starts the month you reach 65. Okay. Okay. Somebody asked a question regarding employment. Is self-employment included in that? Only it depends. With self-employment, it has to meet certain stipulations. So not everybody who's self-employed is exempt from that. Okay, so if you enroll in Medicare 1, 2, or 3 months before you turn 65, your coverage starts the month you turn 65. If you enroll the month you turn 65, your coverage starts the month after. And we're talking about Part B here. Part B is the one that covers 80% of your doctor benefit. Okay. If you enroll the month after you turn 65, then your coverage starts 2 months after enrollment. If you enroll 2 or 3 months after age 65, your coverage begins 3 months after your enrollment. Now, if 3 months go past your 65th birthday and you haven't enrolled, then you can only enroll during the general enrollment period, which is January to March of each year. Okay, so that's called the general enrollment period. That has nothing to do with the Medicare open enrollment that you hear about every year, October 15th to December 7th. That has to do with people who are changing plans, like going from a Part C plan Medicare. They want to go back to traditional Medicare. So that's what it is. So as somebody said, if I'm still employed by the federal government, do I need to enroll in Medicare? No. If you have a health plan through your employer, okay, you do not have to apply. You don't have to enroll during the initial enrollment period. You have what's called the special enrollment period, which is coming up here on this slide. So if I am working and I have health insurance through my employer, or if I'm not working, but I'm covered under a working spouse's employer on their health plan, then I get what's known as the special enrollment period. That means that I have 8 months from the time I stop working or my spouse stops working that I can apply for Medicare and not get a penalty. The penalty comes with the Part B, okay, the one that covers the doctors. So yeah. So anyway, so if I stop working, let's say in February, and so the 8-month clock starts ticking the month after I stop working. So I've got 8 months to sign up for Medicare Part B. And in order to sign up for B, I have to have A. But I have to sign up for B within 8 months, because otherwise I'm going to pay a penalty. All right. So now if I'm under my spouse's plan and I'm about to turn 65 or whatever, but maybe I'm 67 when she stops working. Okay. As long as I can show that for the 2 years between 65 and 67, I had health coverage through my working spouse's employer, I do not have to pay a penalty on my Medicare Part B whenever I sign up. But now, if 8 months go by and I didn't sign up for Part B, I'm no longer working, or I had the coverage under my spouse, she stopped working, and it's been more than 8 months, well, then if I miss the initial enrollment period and I miss the special enrollment period, I can only sign up during the general enrollment period. And that's January to March of each year, the general enrollment period, January to March of each year. Okay. So if, let's say, a person stopped working last year in April, okay, and it's been, the 8 months went by and they never signed up, okay, now they can sign up now during the general enrollment period. But the rule is, if you miss your initial enrollment period and or you miss the special enrollment period, the only time you can sign up for Medicare Part B is during the general enrollment period. The general enrollment period is January to March of each year. And for every year, for every 12 months that went by when you could have signed up and you didn't, your Medicare premium is 10% higher. So if let's say I was covered under working spouse's plan and I was 70 when my spouse stopped working, well, that's okay, as long as within 8 months of my spouse stopped working, I sign up for Medicare during the special enrollment period. But if 8 months go by and I didn't sign up, I can only enroll in Medicare from January to March of each year. And because I did not enroll during the special enrollment period, now my Part B premiums are 50% higher because I'm 5 years late in signing up for Medicare Part B. And so therefore, my premiums are going to be 50% higher for Part B, and that never goes away. Now, same scenario, but let's say my wife stopped working 5 months ago, okay? I'm within that 8-month period. I was covered under her health insurance through her employer, and it hasn't been more than 8 months that she stopped working. So now I get Medicare. I pay the premium for Medicare Part B as long as I can show that I had coverage between 65 and 70. I don't have that penalty of 5 years. Well, hey, well, you're late. No, as long as I can show, hey, wait a minute, I'm 5 years late because I had health insurance coverage, either through my employer or my spouse's employer, and it hasn't been more than 8 months that I stopped working or she stopped working, then in that case, I'm good. Okay, so let's talk about the different parts of Medicare. Part A, it covers the hospital. If you have 40 work credits, if you work 10 years in jobs that paid into Social Security, or you had a spouse that worked 10 years in jobs that paid into Social Security, then your Part A is free. Okay, so what does Part A cover? You have a deductible of $1,556, which probably, don't worry about it, that's probably your first hour in the hospital. Okay, the next 60 days is covered by Medicare Part A. So basically, Part A is going to cover your hospitalization for the first 60 days, except for a deductible of $1,556. Okay, so that you don't have to pay for that. Okay, that is free. That's the one that sometimes people sign up for at 65 because they think, oh, I was told that if I don't sign up for at least Part A, I'm going to be penalized. That's not true. If you're working and have health insurance through your employer or through a working spouse's employer, you don't have to sign up for A or B. Okay. So Part B, all right. Part B is the one that's not a freebie. Okay, that cost $170.10 this year. That's every month. So if you are getting Social Security and you are signed up for Part B, we will take that $170.10 and automatically deduct it from your Social Security check. That's how it works. Okay, now Part B covers 80% of your doctor bill after you pay deductible of $233. So remember, I told you Part A covers 60 days of hospitalization. Yes, but if you're not signed up for Part B, those doctor visits in the hospital are not going to cover you. Okay, so you got to make sure you got A and B in order to cover your hospitalization, because hospitalization, Part A would only cover the hospital, but not the doctor visits. Okay, so if your doctor charges, let's say, $60 a visit, okay, so after 4 visits, you've paid $240. So you're $7 over the deductible. So from that point on, the next doctor visit, all you got to pay is 20% of the normal $60 you would pay. All right. So instead of paying $60, you just pay 20% of that. That's how Part B works. Okay. Part C. All right. So people say, is there something that incorporates A and B and maybe might provide also an HMO or PPO? The HMO, well, it can be a money saver because the $170.10 the Social Security was taken out for Part B, because in order to sign up for C, you have to be signed up or enrolled in A and B. All right. So if you want to switch over to a Part C plan, okay, if you take an HMO plan, that will have a prescription drug plan in it. Because if you have traditional Medicare, A and B, or original Medicare, they also call it, that doesn't provide coverage, drug coverage, unless you're in a hospital. If you're out of the hospital, then all drug costs are on you. So if you want a prescription drug plan, you got to sign up for Part D, and we'll talk about in a minute. And that has deductibles and copays and everything. Whereas Part C, if you have an HMO type plan, that has D in it. It has a prescription drug plan written into it. So there's not a separate charge for that. And usually the charge for Part C is the $170.10 that we were taking out for B. The company contacts us and tells Social Security, hey, this person is under our Part C plan. So the $170.10 that we were taking out for your Part B, we turn it over to your Part C plan. Okay. Now, if you have a PPO type plan, they don't have drug plans included. So you'll have to get a Medicare Part D if you have Medicare Part C PPO type plan. But if you have an HMO type plan, you can drop a Part D, or you never need to sign one up while you're under the HMO under Medicare Part C. Okay. And Part C covers A, B, and D. So it covers hospitalization, covers doctor visits, and covers prescription drugs. So it can be a money saver for a lot of people. But remember, it's an HMO type plan. So most times you got to stick with the doctors in the plan. You may not like the doctors in the plan. You may not want to leave your specialist. Whereas if you have the original Medicare A and B, you can kind of pick what doctors and what hospital you want to go to. Whereas if you have a HMO type, you can't say, well, I don't want to go to this hospital, I want to go to that hospital. Well, if that hospital is out of network, your Part C plan is not going to cover it. Okay. So, all right, next slide. Part D. All right. So Part D is the prescription drug plan. If you have traditional or original Medicare A and B, and you want prescription drug coverage, you can sign up for Part D. Now, these are through private plans. So for this, you could go to Medicare.gov and click on Plan Finder. You put in the medications you take and your zip code, and it will give you the 3 most economical plans that cover most or all of the prescription drugs that you take. All right. Or you can call 1-800-Medicare. Remember, it's a 24/7 number, and talk to somebody and ask for their advice. Okay. So the Part D plan, on average, they're about $32 a month. Okay. But they do have copays depending on the plan and things like that. And remember, the Part D plans have formularies. That means the drugs that they cover. If your doctor prescribes a medication that's not on the formulary and there's not an equivalent medication, then your doctor needs to write a letter to your Part D plan and say, my patient must have this medication, no generic, no substitutes. And if that's the case, then your plan should cover you till the end of the year, when you can switch to another Part D plan that does cover the particular medication that you're taking. Because I mean, things happen during the year. You may pick a particular plan because the medications you're taking are all covered. But suppose you develop a condition there that requires another medication during the year, and that's not on your company's formula. As long as your doctor writes a letter saying my patient must have this prescription, that plan is obligated to cover that drug till the end of the year. Okay, so there's A, B, C, and D. Now, if we can get to the next slide. Okay, so again, if you're employed at 65, you don't have to worry about A or B. Okay. If you have health insurance through your employer, not private health insurance, through your employer. Okay. COBRA doesn't count. So if you've been laid off, okay, and you have COBRA coverage, the 8-month clock starts ticking. If you're not in the initial enrollment period, you get that special enrollment period, but that's 8 months after you stop working. So COBRA is not considered health insurance through your employer. Okay, so you have to be working to be exempt from filing it or enrolling in Medicare at 65, or covered under a working spouse. Okay, and now this is important, because we all get flooded with this thing toward the end of the year about Medicare plans, and you better sign up, you may pay a penalty. People think that even if they're employed, that at 65, they have to sign up for something under Medicare. So they go ahead and sign up for Part A because that's free. So everybody says, oh, good, and I won't have to pay a penalty now. First of all, you didn't have to sign up for Part A in the first place if you were 65 and were working and had health insurance through your employer or your spouse's employer. You're okay. But if you did sign up, this is important. If you have a health savings account at work, you cannot put any money into that health savings account while you are under Medicare Part A. All right. So if you signed up for A and you have a health savings account, don't put any money into Part A, because it's not going to, IRS is going to fine you. I don't know why. Okay, that's just their rule. Now, what you can do, if you signed up by mistake thinking that you had to sign up for A, at least for A, or else you would get a penalty, you can withdraw and then come back and sign up again if you have an HSA, a health savings account, and want to keep putting money into it. If you don't have one, forget about it. Don't worry. Stay with Part A. It's going to be secondary. As long as you're employed and have health insurance through your employer, Medicare will be secondary payer. Okay. All right. Next slide, if we can get to it. All right. Now, here's another thing. If you're at least 65 and a half or older when you enroll in Medicare, okay? If you're at least 65 and a half or older, when you sign up, we always take you back 6 months. You always get enrolled retroactively 6 months in Medicare Part A. I don't know why, but that's the rule. And you can't say, I want Medicare as of now. Don't go back 6 months. You get signed if you're 65 and a half or older. All right. So let's say that you signed up at 65 and a half, but you didn't think you were going to sign up during that 6 month period and 6 months prior to when you stopped working, let's say, and you had a health savings account. Well, if you put any money into that account, IRS may fine you. So if you're 65 and a half or older when you enroll in Medicare, if you have an HSA at work, a health savings account, try to not put any money into that HSA 6 months prior to you're enrolling in Medicare, if you're 65 and a half or older, okay? So don't do that, because we're going to take you back 6 months. And if you had any activity in your HSA, you may get a fine from IRS. So Okay. And as I said, Medicare is secondary payer, while if you have health insurance at your work or your spouse's work. Okay. So if you have 40 credits from Social Security, what we used to call quarter, all right, 10 years of work in a job that paid into Social Security, they don't have to be contiguous. It could be 2 years here, 3 years there. But if it adds up to 40 credits, okay, then Medicare Part A is free, right? If you're older than your spouse and you're about to be 65 and your spouse is still working, you can sign up for Medicare Part A using their credits. Okay, that's not going to take anything away from them. Okay, so you can use their credits and be signed up under your spouse for Medicare only. And by the way, you don't have to sign up for Social Security when you sign up for Medicare. You can just sign up for Medicare only if you're planning on continuing work and you don't want to collect Social Security at this time. Now, if you have 30 to 39 work credits, then Part A is $274 a month. If you have less than 30 credits, work credits, then it's $499 a month, right? But again, if you have your 40 credits or your spouse does, then Part A is free, okay? All right, so Part B, some people may say, well, wait a minute. You just said a few slides back that Part B is $170.10. I know a lot of people that are paying a lot more than that, and they didn't sign up late. They're not paying a penalty. So how come their Part B premium is higher than $170.10? Okay, when Medicare Part D came out, the prescription drug plan, Congress changed the rules on Medicare. And they said, well, Medicare is fairly cheap. And we think that people that are better off shouldn't be paying the same premium of somebody who's maybe financially challenged. All right. So they said, okay, if you have a higher income and you're under Medicare, your premiums may be higher. So this is called the modified adjusted gross income. So after you've applied all your, I guess, deductions, whatever. So whatever your modified adjusted gross income is, if you're filing as an individual and your modified adjusted gross income is over $91,000, or you file as a couple and your modified adjusted gross income is over $182,000, your Part B premiums are going to be higher. Now, we're in 2022, but of course, most people haven't filed their income tax yet. So we can't use your information from 2021 because we don't have that yet. So the 2022 premiums will be based on your income for 2020. Okay, so if you had, let's say you sold a house in 2020 and you made a lot of money, capital gains, whoa, that your income went way up. So your 2022 premiums for this year, your Part B premiums may be a lot higher than $170.10, but 2023 will be based on your income for 2021. So if you didn't have those capital gains in 2021, and then that your Medicare premium will be adjusted. So it'll be adjusted upward or downward depending on what your modified adjusted gross income was basically 2 years ago. All right. Now, there are situations like if you suddenly lose your job, you become widowed, notify Social Security because we may be able to adjust your premium that way. But normally your premium depends on what your income was 2 years ago, unless you suddenly stop work or you get widowed or divorced or something, then that could be that's what they call a life-changing event. And then it could be possible for us to adjust your Medicare premium. Okay, next slide. Okay. A couple of years ago, military people would come up to me and say, well, we have Tricare coverage, so we don't need Medicare. We don't have to sign up. And that's not true. If you are, in order to keep your Tricare, you must sign up for Medicare when you're eligible. Okay, so remember, that's either during the initial enrollment period, if you're not working at 65 or not covered under or not covered under a working spouse, or during the special enrollment period if you're working. All right. All right. So remember, or if you miss those two, then during the general enrollment period, in order to keep your TRICARE, you got to sign up for Medicare A and B. Okay. So again, if you don't sign up for Part B in a timely manner, you can't say, well, I'm covered under VA insurance, health insurance, so I don't have to sign up for Part B. That's not true, okay? And the health insurance you have under VA is not because you're working under them currently. It has to be, in order to be exempt from enrolling in Medicare during the initial enrollment period, it has to be through a spouse for whom you're currently working. I'm sorry, an employer for whom you're currently working, or if your spouse is currently working. Okay, so if you're retired from military and you can't use the TRICARE and say, well, you can't give me a penalty on my Part B premium for signing up late because I had the TRICARE. That doesn't work that way. Okay, next slide. Okay, Medigap. All right, remember we said that for Part A, there's a 1566 deductible, and for Part B, it covers 80%. So some people want to know, well, is there something that covers that 20% that B doesn't cover? And that 1566 of copay for Part A, yes, those are called Medigap plans or Medicare supplementary plans. Okay, now those can be expensive. All right. So, but some people get them. They want to stay with original Medicare because they want to have choice, pick out the doctors that they want to have. And they don't feel they could get that with Part C. So they choose traditional or original Medicare, and they get a Medigap policy, which fills in those holes that Part A doesn't cover. Okay. Next slide. Okay, so when do you buy a Medigap policy? Well, when you first turn 65, but you have to have, in order to have Medigap, you have to have A and B. Okay, and you can purchase a policy whenever the company agrees to sell you one, but they make their own rules. So you can go to Medicare.gov, find a plan for the Medigap comparison tool. So you can see what the different plans are, what they cover, what they don't cover. Okay, next slide. So do you need Medigap? Well, if you have the original Medicare, yes and no. I would say, why go to that extra expense? But, you know, some people maybe don't have to worry about that extra expense. So that's okay. That's an option for them. But I would say for most people, they don't have Medigap. They don't need it. Okay. So, and you have to ask yourself, can I afford the additional, in addition to paying the premiums for traditional Medicare, can I afford the premiums, deductibles, and copays of my Medigap plan? Okay, and Medigap does not cover prescription drugs. So if you have traditional or original Medicare A and B, and you buy a Medigap, that's not going to cover your drugs. So you still have to buy. You have to pay for and enroll in Medicare Part D. So you have to have A, B, D, and this Medigap. So, like I say, that's probably, I would say, probably not a viable option for most folks, but check it out. It might be something that works for you. Okay, next slide. So, Medicare Part D, again, if you have Medicare A and B and you want a prescription drug plan, you need to sign up for D. Now, unlike A and B, which you sign up for, excuse me, through Social Security, D is through, just like C, they're through private plans. So you can go to Medicare.gov or call 1-800-Medicare, or you can talk to a plan and then see if that suits your needs. There are times also when you can switch to if you don't like the part during the open enrollment, you'll be able to switch to a Medicare Part D plan that might suit your needs. Or you might think that you want to switch over to a C plan, which already has a prescription drug plan built in. That's up to you. That's just choices that you have. But if you take the D plan by itself, because you have traditional Medicare A and B, the D does have co-pays and deductibles associated with it, depending on which plan you pick. Okay, next slide. Medicare Part D also has a late sign up, so penalty. So if you are not working at 65 and you sign up for A and B, remember you have that up to 3 months before or 3 months after your 65th birthday. For the Part D, you have basically 63 days to sign up for Part D plan, unless you have prescription coverage through your job. If your employer has a prescription drug plan, then you don't have to sign up for Part D within 63 days, within 2 months, okay? Otherwise, there's also going to be a penalty for late sign up for that one. Okay, next slide. All right, so there's the way you can enroll in Part D. You can go to call 1-800-Medicare. You can contact the private plans. Now, you can get extra help if you know someone whose resources are below $13,290 as an individual, or $26,520 as a couple. They might qualify for extra help, which means that the state would pay the partial or all the premiums on your Part D plan and possibly Part B also. Okay, if your income is below $19,320 as an individual, $26,130, then you might be eligible to get that extra help to pay for your Part D. And if you get extra help to pay for Part D, then you might be able to be enrolled in a state plan to help you pay the premiums for Part B. Okay, and that would be a money saver. Okay, and as you see, the last bullet point says, if you have a Medicare Part C, an HMO type plan, then that should include a drug plan. So if you had Part D, you can drop it, or if you never had it, well, now you're going to have a plan that covers doctor visits, hospitalization, and prescription drugs. Okay, next slide. Okay, so the Medicare Advantage plans, again, they are managed by private companies, not Social Security or Medicare, all right? And in most cases, you have to use the doctors in network unless you take a PPO type plan. But PPO type plans won't have drug coverage included. The Medicare Part C should have drug coverage in it. So if you are in Medicare A and B and want to go to Part C, but you had D prior to going to C, you can drop your D plan. Okay. By the same token, if you signed up for a Medicare Advantage plan, Part C, and you don't like it and you want to go back to traditional Medicare, that would happen during open enrollment, October 15th to December 7th. And then you would be back to original Medicare starting January of the following year. You need to know then you need to sign up for Part D again if you want prescription drug plan, if you want a coverage. But if you're under Part C, you should have that drug coverage included. And as I said, it can be a money saver for people. All right, so you don't have to pay the deductibles and co-pays and premiums on the Part D, because it'll have that if you have a Medicare Advantage plan, an HMO type plan, then that'll. And this does not work with Medigap. So you can't have a Medigap policy if you have Medicare Part C. You have to drop it. Okay, next slide. All right, so you can join, switch, or drop your C or D plan or return to original Medicare during open enrollment, which is October 15th to December 7th of every year, okay? So if you enroll in Medicare during the general enrollment period, okay, because you're a late enrollee, you can then enroll in Part C from April to June. Okay, now let me tell you something. Remember, I told you that if you miss your initial enrollment period and your special enrollment period, you will be penalized. Your Part B is going to be higher. Not only that, but your Part B coverage doesn't start till July of the year you signed up. So even if I came in January and I said, oh, you know, I had Medicare coverage through my spouse, but she stopped working. And they say, well, when did she stop? Well, 10 months ago. Okay, so I was stuck. So now I come in January, and during the general enrollment period, now I can sign up. But my Part B coverage, even though I signed up in January, doesn't start till July of the year I sign up. Okay, so that, but now my understanding is that's going away next year. Next year, if you're a late enrollee and you sign up during the general enrollment period, your Part B coverage will start the month after you enroll in Medicare A and B. So if I come in January and I say, oh, I goofed it up and I never signed up for A and B when I should have, or or you already have A, but you didn't sign up for B when you should have, then in that case, you're not going to have to wait till July. If you sign up in January of next year, then starting February, your Part B coverage, you would have coverage for 80% of your doctor visits. Okay, next one. Okay, so if you're enrolled in a Medicare Advantage plan, you can switch from a Medicare Advantage plan with no prescription drug coverage. That would be like a PPO type plan to one that has drug coverage. Okay, you can drop Part C and return to original Medicare. You can enroll in Part D if you go back to original Medicare, and you can do that from January to March of each year. So from January to March of each year, you can switch from a Medicare Advantage plan that has no drug coverage, which would basically be a PPO, to a Medicare Part C plan that does have drug coverage, okay? Or you can drop Part C and return to original Medicare, all right? All right, now, you must be in a Medicare Advantage plan to use this enrollment period, and coverage begins the month after enrollment. Okay, so if you drop Part C and return to original Medicare, you don't have to wait till open enrollment in October. You can actually do that, like let's say if you do it in February, then starting March, you should be back to original Medicare, okay? All right, living outside the United States, this is important. If you're going to travel outside the United States, Medicare A, B, C, or D is not going to cover you. So if you're on vacation, check with your carrier and go for vacationer's insurance. It's dirt cheap and will cover you while you're outside of the United States. If you move outside of the United States, please get health insurance from the country where you live. In most places, it's dirt cheap, a lot cheaper than it is in the US, okay? Now, if you're gonna go back and forth, don't drop the Medicare. If you're never gonna come back to the US because all your family is outside the US, all right, then you can drop Medicare. You can keep A, it's free, but it's not gonna cover you, but you can keep it, all right? But Medicare, just remember, so even if you're going on that cruise, once you leave, what is it, 50 miles, whatever, the territory that 50 miles out, you're outside of US territory, you're not going to be covered by Medicare, okay, for those bills. So think of that, okay? All right, next slide. All right, so for more information, you can go to 1-800-Medicare. Again, call after 5. Don't call between 9 and 5, okay? Or call on the weekend. Call at midnight, okay? Call at 6 a.m. You're not going to have a lot of competition, and it's going to be easier to get through that way. Or if you want to do it yourself, go to Medicare.gov, and there's a lot of information available there. And also information at the Social Security site, SSA.gov or socialsecurity.gov, okay?
All right, I'm going to go ahead and read out some of the questions we've received, and I do want to tell attendees that you're welcome to put questions in the chat box, and we're happy to address them during this question and answer period during the remainder of time that we have today. Andy, here's a question about HSA and Part A. Here's the question. If I'm still employed and I signed up for Medicare Part A, which automatically occurred when I signed up for Social Security, will I still be penalized for having an HSA?
Well, the penalty doesn't come from us. It'll come from IRS if you put any money into it. Okay, so that's the thing. Now, my understanding is if you're getting Social Security benefits, you have to be signed up at least for Part A, if you're getting benefits. If you drop the Part A, they're going to stop your benefits. That's my understanding. Okay, so the only option you have is don't put any money into that HSA.
Can you talk a little bit about the best time to enroll in a Medicare supplement plan?
Okay, you're talking about the Medigap, the Medicare. I really don't know. I think you can. I think you can apply it anytime, but you need to. Again, you need to talk to the Medicare supplement plan, because let me tell you, they make their own rules. Okay. In other words, Medicare gives them certain standards that they have to abide by, but they also make their own rules as to who qualifies and who does not. So you need to check with the supplementary plan as far as, you know, the advantages and disadvantages of that. So yeah, but I think you can sign up for a Medicare supplement at any time. There's not a certain time when you can only sign up for it. Okay.
I have a couple more questions here. Here's one about couples. So for example, what if one spouse is eligible to sign up for Medicare, but the other one isn't? Say they're not old enough. How does that work when, say, one spouse is working and the other isn't? Can you talk a little bit about how spouses coordinate signing up for Medicare in addition to having private insurance through their employer? And I'll let you go from there.
Okay, if I'm older than my wife and she's still working and I'm on her employer health plan, even though I'm about to be 65, remember, I don't have to sign up during the initial enrollment period because I have coverage through my spouse's employer. So I get that special enrollment period. So that means whenever my spouse stops working, then I have 8 months to sign up for Medicare A and B without a penalty, as long as I can show that between age 65 and whenever my spouse and within 8 months of my spouse stopped working, I was on her employer health plan, then it's okay. Or if I'm the one working and I stop working at 70, as long as I can show that between 65 and 70, I had health insurance through my employer and it hasn't been more than 8 months that I stopped working, then it's okay. I won't be subject to a penalty for enrolling late. And remember, if you are a late enrollee, then you can only then sign up or enroll in Medicare during the general enrollment period, which is from January to March of each year. So if like if my special enrollment period, well, okay, let's say my special enrollment period ended up in last November, okay? That was, so I could sign up during the general enrollment period, which would be January to March of each year. But let's say for whatever reason, maybe I was out of the country or whatever, I never signed up. And now it's like April of 2022. Well, you know what they're going to tell me, Social Security, come back next year during the general enrollment period, January to March. So the people that are late need to remember that the only time they can sign up is, because sometimes they get confused and they say, oh, there's open enrollment October 15th to December 7th. I can always, no, you can't. That has nothing to do with that. The general enrollment period, the late enrollees can only sign up during the general enrollment period, unless, as I said, they're subject to the special enrollment period. In that case, they wouldn't be a late enrollee. As long as you can show you had that coverage all between 65 and the time you come in, and it hasn't been more than 8 months that you or your spouse stopped working, you're good. You won't be considered a late enrollee. Okay.
All right, and then I have one more question here before we have to end. It says, when I retire, I can keep my federal health insurance. Will signing up for Medicare make those costs go down?
Oh, well, that's a that's a question that you have to ask your HR department there, as far as do your costs go down. Now, once you stop working, Medicare will be primary, and logically, those health costs should go down. But anyway, I would check with the HR department. So remember, as long as you're working, you don't have to sign up for Medicare. You have this because you're working and you have health insurance. You have that special enrollment period. So even if you go past age 65, you have to sign up for A and B until you're ready to stop working. Then you have that 8 months to sign up for A and B, and then but they will be primary instead of secondary as they are now, because some people signed up for Part A and they still have their health insurance through their work and they're working. So right now, while they're working, their health insurance through their work, through their employer, is primary and Medicare is secondary. But once they stop working, then Medicare will become primary.
Well, looks like that's all the time we have to address questions today. On behalf of Advice Chaser, we do want to thank our speaker. We want to thank Andy for being here and for the organizations that have made this presentation possible today. Thank you so much for attending. Look for an email soon for a replay of this event, and you're welcome to share that replay with friends and family. Here at Advice Chaser, we're all about helping you find a financial advisor who's a great fit for your life and your financial questions. Our matching service is free to you, and every one of our advisor partners has committed to offer a free initial consultation to anyone we introduce them to. Find out more by going to advicechaser.com and clicking on the link to find an advisor. Once again, from Advice Chaser, thank you so much for coming, and we will see you at another webinar very soon. Bye, everyone.